Thank you for joining us today for the first in a two-part series of listening sessions around men and contraception, sponsored by Male Contraceptive Initiative. My name is Dr. Michelle Kaufman. I am a social psychologist and an associate professor in the Department of Health, Behavior, and Society at the Johns Hopkins Bloomberg School of Public Health. I'm also the director of the Gender Equity Unit, and I have the pleasure of moderating today's session. The goals of these two sessions are to listen to experts in health and gender norms, identify how to better engage men in their own reproductive health and family planning, as well as to explore gaps and opportunities in the current contraception landscape to work towards humanizing the field, and ultimately to help prepare the landscape for the advent of novel male contraceptive methods. Today's session is focused on establishing an evidence base for making contraception and family planning a human health issue by looking at masculinities and gender norms. Part two will be held on Wednesday, May 14th at the same time, and will focus specifically on men and novel male contraceptives. As an overview for today, it's important to note that the field of family planning and contraception has been embedded in and often conflated with women's health. Any inclusion of men and boys in the field has been geared to male engagement in women's family planning needs and efforts. There's been a lot of media coverage recently around new masculinities and modern gender norms, jumpstarting conversations between couples around the globe as to whether and when to have children. With the advent of novel male contraceptives on the horizon, today's listening session will consider how to move the discussion forward on a societal level in new directions that consider contraception as part of human health and well-being. My own research over the past couple of decades has focused on sex, gender, and sexuality as predictors of health and health disparities, including the role of boys and men and masculinities. So I'm especially excited to be guiding this discussion today. So now let me introduce today's esteemed panelists. First, please meet Dr. Lisa Campo Engelstein. Lisa, can you give a wave? Lisa is the director of the Institute for Bioethics and Health Humanities at the University of Texas Medical Branch. Trained in philosophy, she approaches topics in medicine from a feminist and queer perspective. She specializes in reproductive ethics, especially assisted reproductive technologies, abortion, fertility preservation, male contraception, and queer reproduction. Next up is Dr. Margaret Green, the director of Greenworks and a senior fellow at Equimundo. Margaret has more than 25 years on working on the social and cultural determinants of health and gender. She's an expert on child marriage and boys and men's contributions to gender equality. Margaret led the framing article of the Lancet series on gender equality, social norms, and health. Welcome, Margaret. Next, we have Dr. Taveeshi Gupta, who is the Senior Director of Research, Evaluation, and Monitoring at Equimundo, which is a leading feminist civil society organization that promotes caring and equitable masculinities globally. Taveeshi's research has highlighted constructions of masculinities and gender and the role of structural inequalities to healthy and positive human development. We're very fortunate to have both Taveeshi and Margaret here today from Equimundo, as they have been seminal in developing the evidence base on men's health and gender norms. Now I'll introduce my colleague at Johns Hopkins University, Dr. Arik Marcel. Arik is a professor of pediatrics and public health at our School of Medicine and in the Bloomberg School of Public Health. Arik has been committed to improving adolescent sexual and reproductive health and access to care, especially for male adolescents and young adults, for more than 30 years. And his research focuses on creating clinical care touchpoints to support adolescent and young adult males in their sexual and reproductive health and expectant fathers in their new role as parents. Welcome, Arik. And finally, another one of my colleagues from Johns Hopkins, also in the Bloomberg School of Public Health, we have Dr. Dominique Shattuck. Dominique is a cutting-edge men's health researcher, community psychologist, husband, and father. He has led groundbreaking studies and implementation projects that engage men and women, couples, and adolescents around their reproductive health. Dominique writes a popular column on Substack on men's health and well-being, and is often featured as a men's health expert with organizations such as the American Institute of Boys and Men and the Good Men Project. He teaches courses on men's health at Georgetown and Johns Hopkins universities. Dominique, thank you for representing the Bloomberg School of Public Health today. So just a bit of housekeeping. We have a graphic note taker with us today from Breakthrough Visuals, who will be live capturing key points and ideas uncovered during this listening session. So welcome to Terry. Thank you. The next 45 minutes will be a conversation among the panelists based on their vast knowledge in the field. And the chat will be open during the conversation for audience members to add your thoughts, to pose questions for the panelists. We'll also be sharing links for resources mentioned in the listening session in that chat box. Panelists will field audience questions for the last half hour of today's session. So please feel free to send questions as we go along. This session is also being recorded and will be shared afterward. So now let's get the conversation started. So there's often a conflation of reproductive health with women's health, which could be causing the disconnect of men and boys from their own reproductive health and autonomy. Lisa, I want to start with you. Based on your work as a bioethicist, can you speak to the origins and then to the current state of this idea of reproductive health being a woman's issue?
Sure. Thanks so much. So when we think of reproduction, we often think of pregnancy, and pregnancy is mostly experienced by cisgender women. And so we have this historical idea of reproduction being conflated with pregnancy. And we see this in the language that we use to talk about infertility and fertility, things like barren womb, right? There was this historical idea that if a man was sexually virile, he couldn't be infertile, right? We don't talk about barren scrotums or anything like that. And this has continued even today. We see that in infertility treatments, it's often assumed that the man is fertile if he is able to maintain an erection. So this continues this idea then that this is just women's responsibility or a woman's issue.
Thank you. So continuing in this vein, Taveeshi, what are your thoughts about how gender norms affect the decision makers around contraception use versus contraceptive users?
Yeah, I mean, absolutely. We actually collect global data on this very topic, and we have seen that the distinguishing between decision makers and users is seeped in gender norms. So I'm going to refer to this study called the International Men and Gender Equality Survey, Images, and we have been doing that for over 15 years, and we have about 67,000 respondents, right, globally. And so when we ask the men and women, because this is a data set that captures data from men and women, who is decision-making shared equally, we get similar rates. Women say 65% of women say that yes, decision-making is shared equally. Men tend to over-report, and we get about 75% of men saying the decision-making is shared equally. Either way, it's quite close, right? But then we start looking at attitudinal responses to exactly what you were referring to, Lisa, right? It's a woman's responsibility to avoid getting pregnant. And we see across all the countries we asked, more than 30% of men agree that it's a woman's responsibility to avoid getting pregnant. Or I would be outraged if my wife asked me to use a condom. This is actually at 49% in Azerbaijan, 62% in Nigeria. Men are agreeing with these statements. And this like idea of men's virility, right? Men need more sex than women do. Again, more than half the men in 11 out of 20 countries agreed with that statement. Yet the contradiction is clear when we go back to that initial point. Palestine, Lebanon, Uganda, Tanzania, when we ask them, like of the men who say that it's a woman's responsibility to avoid getting pregnant, 30% also say that decision-making should be male-led. So there is this kind of contradiction between both of them, right? And this is at individual level, but what happens at healthcare systems level? Often health providers reinforce these stereotypes by directing contraceptive counseling only to women and excluding men from these conversations. And in future, like part of the conversation, I'll discuss a little bit more around that. But when you make assumptions about appropriate methods based on gender rather than individual needs, we end up reinforcing this like user versus decision-making disparity as well.
Taveeshi, just curious, the survey you referenced, was that a one-time thing, or is that something that you're collecting data at multiple time points?
Unfortunately, at the moment, it is cross-sectional, but the great thing about this particular survey is that it is being conducted over 15 years in different countries. So we can sort of see those trends. And I think that link has been popped into the chat as well. And Margaret and I were co-authors on this global report that actually looked at those trends across 33 countries. So it is at one time point, but collaborating it and triangulating it with DHS data, et cetera, gives us similar findings as well.
Yeah, it would be interesting to see how attitudes have changed or not over the years. So Dominique, can you speak to your research about motivating men to communicate about family planning? I know you've worked on this in the country of Malawi.
Yeah, for sure. And it really kind of dovetails nicely with the statistics, the unhopeful statistics that Taveeshi shared with us a minute ago. Is that what do you do in this situation? How do you engage men and how do you work with them to kind of facilitate women's access to reproductive health services, either consider themselves as clients of reproductive health services and getting vasectomies or using condoms or abstaining for during the fertile window? How do you put these interventions together? And in Malawi, we had a project that was, kind of focusing on men who were married to younger women and kind of elevating their knowledge about reproductive health services, as well as kind of the benefits that both physical benefits and the financial benefits they gain from delaying and having children within a appropriate time period of 2 years. So we saw that in this intervention, we worked with the men through different activities where they were able to kind of get into peer groups, couple sessions, even programs similar to this have been implemented later under faith-based organizations. And in these situations, the men, they listened to the project and they listened to the activities, they shared their experiences, and they began to rethink how household and power dynamics were happening, and ensuring that their partner was able to get the services that they need. And for the funder, we hit targets around, not targets specifically, but we hit goals of increasing women's contraceptive uptake. But so much more good stuff was happening in these households, right? So they were working together, they were communicating better. And in these gender transformative interventions, you're seeing this kind of shift with the way in which people were living and interacting with one another, which kind of can spill over into other aspects of their lives as well. We actually, in the last year, we curated a number of different curricula similar to this, and I'll share the link, or someone will share the link to the Male Engagement Resource Compendium that was developed by our team at Breakthrough Action, where we have those curriculum available. And in the coming couple of months, I'll be going through some of those to pull out some of the activities for a presentation at the ICFP conference coming up. But yeah, those interventions exist. They're built on work by Equimundo and places like Stepping Stones and these earlier interventions that kind of help to build out the literature. And as more rigorous research is put into place around these studies and around these interventions, hopefully these things can be disseminated into other spaces and contextualized for other men and families. Thanks.
Thank you, Dominique. And Yeah, that communication piece is so important. And it seems like this is an area where couples do not communicate about it. And as we've been saying, it's often just left to the female partner. So let's shift direction a bit to men's involvement in the healthcare system. So there's been research published about how masculine stereotypes and gender norms affect healthcare usage and health outcomes. So, specifically, Margaret, I know your research has found that gender normative influences by parents and peers start early and can have multiple short term and long term health consequences that differ for girls and boys. Can you elaborate on that a bit?
Sure. I guess I wanted to say first, let's think about norms as invisible guardrails that guide our behavior according to gender and age and other factors. So that makes it clear that, we're all channeled and restricted in various ways. Two masculine norms that are kind of traditional masculine norms that are relevant to sexual and reproductive health and contraceptive use include stoicism, which makes men avoid caring for themselves and seeking out services, and the idea that they should dominate in their sexual relationships, which could reduce the kinds of conversations with partners that would support collaboration on contraceptive use. And Dominic was just referring to a program that intervened in that area and supported a more collaborative dynamic. As Taveeshi noted, individual boys and men as potential users of services uphold certain masculine norms, but so do healthcare providers who are community members like everyone else. So, obviously there's a lot of work to do. Our work on the International Men and Gender Equality Survey, Images, has shown the lasting impact of exposures to restrictive gender norms in early childhood. One of the things that we found is that care leads to care. So men whose fathers were involved in caregiving when they were growing up are more involved in caregiving themselves. Men and women who grew up seeing gender equality in their households as children had more equitable attitudes as adults. With regard to who has the final say in contraceptive decisions, overall, women report 65% of those decisions are shared equally, while for men, the figure is 75%. And obviously that varies greatly depending on the specific context. And then our data also show how norms contribute to low rates of men seeking health services, both physical and mental health, by kind of devaluing health access and support, and especially devaluing reproductive health, which they've learned is something that's women's business. So our Images data affirm that link between aspects of traditional masculinity and then practices that are harmful to men's health. And we see measures of stress and poor mental health that are associated with very traditional views that they were exposed to early in life.
Yeah, thank you. And I understand we're seeing much more research linking that restrictiveness to non-communicable diseases later in life. And so, yes, definitely has some long-term negative impacts. Arik, your research and clinical experience has confirmed some of this early research on masculinities and boys' touch points in the healthcare system. Can you speak to that for adolescent boys?
Yeah, and it's a pleasure to be here. And some of my comments will echo the previous comments of others. Really, the original work in this area focused on describing men's barriers to men's help seeking in the mental health arena, and how the role holding more traditional masculinity beliefs play, for example, conceptual frameworks by Addis and Mahalik in this area. And then other work, at this time started to demonstrate associations between young men who are holding more traditional masculinity beliefs and their engagement in risky behaviors, such as substance use. So at the time, I was really interested to examine whether, similar beliefs predicted young men's use of routine preventive care over time, And we examined data from the National Survey of Male Adolescents, which was the precursor for a similar type of questionnaire to be integrated into the National Survey of Family Growth that up to the point, to follow up, I think, on Lisa's comments earlier, really just focused on establishing reproductive health needs for women. It only assessed women, and NSAM really helped to integrate men into these national data collections around reproductive health. So with these analyses, we showed that male adolescents who held more traditional masculinity beliefs were less likely to report having a routine well visit subsequently than those who held more neutral beliefs. But this group really, represented about 15% of the sample. It's this small minority of men, of young men who were holding these more traditional beliefs. Our work, as well as work by others, showed that there's a lot of variation between and within groups of men when it comes to both how they think about what it means to be a man and their health promotion and healthcare use behaviors. And because of this, when I'm thinking about drivers, factors that drive young men's access to care and use, I really think about the social ecological model as a useful framework that speaks to a number of the levels that have already been touched on. So, this model talks about how individuals are nested within their social ecology, how young men's personal behaviors are shaped and influenced by their social, structural, cultural contexts, and how each of these contexts also influence each other. So we've been talking about, how at the cultural level, these cultural scripts reinforce gender role expectations that males be tough and not ask for help. But we also need to think about other contexts. And Meg kind of spoke about this a little bit already. At the structural level, healthcare systems that are focusing on maternal and child health, and really, lack a professional medical organization that addresses reproductive health for men across the life course that really speaks to the needs for all men, as opposed to just subspecialty needs, has created lack of organized approach and a voice for this area of care for this population. This has really resulted in pediatricians and other primary care providers lacking clear guidance on what kind of care to provide to this population related to sexual and reproductive health. And then it perpetuates the lack of sharing of the importance of this care for not only young men themselves, but for families, et cetera. But also our school systems really lack teaching comprehensive sex education. It's just not, there's no standards. And it typically also lacks teaching males about contraception methods beyond condoms or the importance of accessing care. At the social level, we also know that the quality of boys' conversations about sex with their mothers and parents is poor. Young men also report having few discussions about sex with their healthcare providers, as has been shared already, or other well-informed persons who can link them to care. This is really due in part to men's smaller support networks in general, and even smaller sexual health information networks for male adolescents. So it shouldn't be a surprise that at the individual level, young men don't have the sufficient knowledge and perceived need or confidence to support their sexual health care and reproductive care use, or really the reasons why it's important, because they're just not getting the messaging from health promotion, from public health, from us as clinicians in the healthcare system. And because of this, they're just not socialized as part of the healthcare system and don't get opportunities to practice these skills. And then it just creates a revolving cycle.
Yeah, those are excellent points. And one thing I want to expand on is this idea that we can enable the life course approach to reproductive health care for boys and men. So, Arik, you've talked about some changes that would need to happen for that to take place. So things like more comprehensive sex education, better maybe provider training on men and boys' reproductive health, support networks, linking young men to care. Do any of the other panelists want to weigh in on this? What would need to happen for this change to enabling life course approaches to reproductive health care for boys and men?
So I'll chime in. I mean, I think part of, as Arik was mentioning, in the research that he's done and the research he was mentioning earlier is, in this moment where the boys kind of disengage from the health system, or young men disengage from the health system, they're navigating their identity, their sexuality, their relationships, trying to figure all these things out and trying to be adults, taking on jobs and financial responsibilities and things like this. Forgive me if you heard this story before. I use it a lot in my presentations around, I do a lot of these talks and I ask people in the audience to raise their hand if a counselor or a nurse or a doctor has ever talked to them about contraception. And in those conversations, in that moment, every woman's hand will go up in the room, but no men's hands will go up unless it's some old guy like me who's had a vasectomy or something like this. You have this kind of disconnect in terms of reproductive health being at the center of women's health, whereas for men, reproductive health is an afterthought. And so this is really, I see this as a systemic failure. And, kind of what we lose from this is it kind of denies men, it makes you underprepared and underinformed in a lot of ways. But it also denies you with like trusted, accurate information from a healthcare provider. It prevents the normalization, as we've been hearing from other speakers, of contraception and discussions around men and their peers. They can take that information into the bar, into the basketball game, into the video games they're playing, or whoever they're talking with, and share accurate information in a way that's relevant to the people around them, and so that it gets disseminated through their communities. And it also reinforces this kind of misinformation and leaves men defaulting to stereotypes or silence a lot of times, right? And so kind of elevating this, we're taking a public health approach to this. So we kind of center a lot of this in health settings. And I think the health setting can do better than it is currently with men in kind of finding ways to touch men around their reproductive health over time, because we know it also changes. It's different for the 16-year-old young man versus the 45-year-old man with 2 kids who doesn't want to have any more children. So kind of figuring out how providers at different points in your life can kind of come in and work with you and put that, client-centered care, patient-centered care approach to work for men in their clinical settings, or in their primary care physicians and people like that. When you go in for your checkups, I still don't get asked about the reproductive health when I go in. So it's really important to kind of normalize this in our conversations with our primary care providers, as well as in other parts of our life.
Any other panelists want to weigh in?
I mean, I think, Dominic, you sort of summed it up really well, right? The healthcare system can do better. And I think, in an easy way to start seeing it as a structural problem as opposed to an individual problem, I think is the first step. And we have data from different sort of sources. In 2019, our State of the World's Fathers surveyed young fathers, and we found that 70% of men expressed interest in being more involved in family planning, but they didn't find the services male friendly, right? And I think, Arik, you mentioned this as well. A lot of the healthcare providers training is so specific to like sexually transmitted infections or something, which doesn't actually kind of capture the breadth of SRHR issues and challenges that young men, boys can bring. In Rwanda, we did this sort of qualitative study, which looked at dating and relationships among adolescent boys and girls. And something that came up was that adolescents were asked for their IDs anytime they wanted to access contraception. And in a context which already stigmatizes like sexual relationships before marriage and has tremendous implications for adolescents who are caught dating, right? And in a small community where the health workers probably know the families and the parents. I mean, it's set up to actually make adolescents kind of be inhibited from getting and accessing any SRHR services for themselves, right? And so there were so many case studies around that, sort of girls, for example, feeling like the rooms are labeled for pregnancy tests and abortions, and that it would just spread like wildfire in their villages. Boys being told that family planning services are only for adults. So where does a 16-year-old actually go to get that? So these are they're very simple solutions, but actually the ways in which they're set up are meant to make it very challenging for particularly adolescents in different parts of the world to kind of, combat those social and gender norms around it.
And if I could just build on the brilliant comments of my colleagues here, I think it's really important to highlight how this is a systemic issue, and that we can do better in healthcare, but also we need the support on the policy level. Right now, the ACA does not cover male contraceptive methods. So if you are a cis hetero couple and you're deciding between one type of sterilization, tubal ligation or vasectomy, tubal ligation is covered, whereas vasectomy is not in most states. And it's more expensive then to choose that, even though vasectomy is cheaper and easier and more efficient and all these things. So our policies are reinforcing this, and we need to make those types of changes also.
And for those joining us outside of the US, the ACA is the Affordable Care Act that changed a lot of healthcare policies here in the US. As a social psychologist and the mom to an 8-year-old boy, I'm very interested in what Arik and others have alluded to around families and social connections. Is there anything more that can be done there? What do you encourage families to do while we're waiting for some of these larger structural changes that take time? Dominic, I don't know if you want to speak to this. I know you've done work on social connections related to this.
Yeah, there was a paper that we'll share in the notes afterward called Building Bridges that we put together through the Male Engagement Task Force, just kind of looking at the way in which boys, and as has been stated by others earlier, like as they mature, they kind of fall into the stoicism and the isolation and the independence. And, there's been great work done by people like Naomi Way and Judy Chu, who've kind of focused on this maturation process and how it really harms boys in their relationships, going from super emotionally intimate, young child lives in terms of 6, 7, 8, 9 years old. And then as they evolve, they're more standoffish. They won't share their emotions with their friends. And it really has a big impact on, what Arik's research has shown in the past around boys retreating not just from that emotionally intimate moment, but also from their clinical care and not showing up at the clinics, not showing up at the doctor's office for their checkups. And so you have this kind of, being safe and feeling comfortable around in other people in terms of sharing your emotions is really a big deal for men. And sometimes, unfortunately, sometimes when you share those moments, it's not received well. Other guys aren't ready for it. But it is something that you want to encourage in your communities. We notice in Canada, they've just adopted an empathy building curriculum in their national curriculum that will help to kind of build out empathy for, help children practice empathy and see empathy in their classrooms. And hopefully that'll bleed over into their relationships with one another as they're growing and reinforcing that as a positive outcome for boys and a positive behavior for boys. Kind of reframing what masculinity and strength is. Strength isn't just being successful and being strong and physically strong. It's also being an emotionally strong and being there and being a good friend for other people. So how do we kind of reframe this is really critical. And as a parent myself, I had 2 girls, I didn't have a son, but I noticed too when my daughters talk about dating, some of the boys they want to date, they miss them emotionally sometimes. And so, there are kind of elements to this where it has big implications, and you don't want men also to kind of, or young men to also look at women as the only source of emotional strength and support, right? It shouldn't be dumped on women that they're not the receiver of all your emotional baggage, hopefully. Hopefully you have friends and you can kind of work around and talk through some of the issues that you're dealing with your parents and with your friends and other people. But it has huge implications for how, when we talk about this too, in terms of, sorry, I'm going on to a little too long, but when we talk about this around navigating and negotiating contraceptive use, we really need to think about this in terms of, we don't do a good job of it now when it's men and women manage most of the contraceptive burden. So when we start thinking about bringing in these novel contraceptive methods for men, we're going to reframe this whole conversation and negotiation. And we need to be really mindful of how we bring boys into that conversation, right? We don't want it to be, we want openness. We want to be clear. We want them to be good communicators in this space. And so part of that will come with building their emotional maturity, their emotional intimacy with other people. So I think, as we're considering this in the contraceptive space, and you can think about it in the proceptive space too, or conception space, that communication is central and critical to effectiveness. And as a mom, I'm sure you're encouraging your son to express his emotions in different ways, right? So, and it's not always easy. And I'm sure I'm 55 years old and I still struggle with it. It's hard. So, yeah.
Yeah, and it happens quickly. He had his first strikeout at a little league baseball game the other day, and I could see he was holding back the tears because he didn't want his teammates to see
Right.
him emotional. And so that's hard to manage that as a parent when you want them to be emotional,
Right.
and to not hold that back. Well, thank you, Dominic. That's great. Taveeshi and Meg, what else does your research say about what we need to change in terms of gender norms and customs in the global context?
May I plunge in, Taveeshi? Well, I think it's interesting because I think that norms related to age are as invisible as gender norms. And in our work on sexual and reproductive health, we're not starting early enough, and we're stopping too soon with regard to sharing information. Equimundo has a global boyhood initiative that addresses the specific needs of boys from 4 to 19. It's not only focused on sexual and reproductive health, but sort of looking at broader, developmental milestones. And one of the things that I find very interesting is that apparently there's in late childhood and early adolescence, there's an important developmental stage that's very where children are very oriented toward justice and fairness, the concept of fairness. And I think parents who have, watched children go through that stage, there's like, wait a minute, I have to do this and they have to do that. They really are understanding that. And that's such an incredible opportunity to be communicating about mutuality and communication and building on that sense of social justice. So starting earlier with boys and kind of laying the groundwork for later communication and so on. Then I also think that it's so sad that there isn't sexuality education for grown-ups. And I think parents really feel this very acutely sometimes, like the things they didn't know, and now how are they supposed to talk about them and so on. But I think, like, what can we offer to adults who are, there's the ageist assumption that they know it all, and what can we offer, and what are the platforms through which adult men in particular, because women do have more exposure through the health services offered them, that where men can learn and build their skills and kind of be more comfortable in the full range of knowledge and skills that are necessary for good reproductive health.
And I think, Margaret, thank you for that, because I think one of the things that I want to also highlight, and I think there's a question in the chat about it too, but I think an opportunity to focus on men when they're either about to become fathers or they're sort of just new fathers is critical. And so what we found, and I'll give an example of this intervention that we've done also in Rwanda called Bande Bareho, It is now in its 10th year of its programming. It's reached over 5,000 couples through 460 education groups. And it has, using gender transformative approaches, demonstrated that engaging men in maternal and newborn health can significantly improve sort of multiple outcomes, from contraceptive use to better decision making and more equal decision making at home, reduced violence against women, reduced violence against children. And we see this even 6 years post intervention. And this program is particularly fascinating because it did start in one district, and now we have sort of Ministry of Health buy-in, and it's being scaled up at national level. There's a lot of sustainability built into it, where we're trying to transfer this to community health workers who can then deliver the program to the communities. And the interesting part in this one is also that the couples were recruited when they came to antenatal care visits. So at sort of these multiple ways and touch points, we're seeing that there is a way where that is a transition point in men's lives where they would be most kind of amenable to kind of being brought into that space of change. So yeah, I think, just adding to that point, saying like, we need to start thinking about adolescent boys, then we need to start thinking about men perhaps when they're getting married, and then when they're sort of at their fatherhood stage. And Michael Flood says this constantly as well. It's like, don't look at men as a homogenous group, right? There's sort of ways in which there's different transition points in their life when we are more, when they're more primed to change.
Yeah, and that gender transformative approach is crucial. Well, we can't really conclude without talking about the elephant in the room. So I wonder if we can speak for a few minutes on the current state of reproductive access and funding in the US and how this might affect the field. So, Lisa, would you like to weigh in on this first?
Sure. So in the US, as we know, there's been an erosion of reproductive rights. And this affects not just women, though. And I think that's part of what we've been talking about this whole time, is that reproductive health affects women and men and folks who identify in all sorts of ways. And perhaps this is a moment in which we can reconceptualize reproductive health as involving all folks, so that we can, so it's not just a woman's issue, so it gets sidelined and pushed to the side, marginalized, but that if it's something that affects everyone, it might be a way to enhance reproductive rights for all. But we do need to recognize that we need to be careful in the way we talk about this, because we're not promoting that men's reproductive rights are greater than women's reproductive rights. It's not a zero-sum game. So giving men reproductive rights doesn't mean that we take away from women. But is there a way to conceptualize this as a shared responsibility? And I think that's where we need to go moving forward.
Would others like to weigh in on this?
I think I would. So there's so we know that there's already some contraceptive methods for men out there, like vasectomy, abstinence, condoms. Some of them may not be everybody's favorite or optimal contraceptive method at the time, but they are there, right? So we know that some work I did with Catherine Packer and Brian Perry at FHI 360 a while back, we know that when vasectomy programs are integrated into the contraceptive method mix and they're done thoughtfully and there's good promotion, they're effective, they're cost effective, and they have huge impact on a couple years of protection. So we know this works. We know this happens. The investment's not often there. And when it is there, you see even like surge activities where you get a lot of men coming in for vasectomy services. Programs like Jonathan Stack and World Vasectomy Day do a great job of short-term, high-intensity marketing of vasectomy programming and also actually changing social norms. And we know that in places like Rwanda, where I worked significantly, you have situations where we're kind of not only reframing the methods and access to the methods, but we're reframing how we see contraceptive users, right? So it's changing from women to men when you start integrating them into vasectomy services. So we need to do more of what's there already. We also know that, Lisa and I actually many years ago, before I only looking back at this paper recently realized she was also co-author on there. Sorry, Lisa, I didn't recall that. But we had co-authored a paper looking at modeled the impact of two different types of novel male contraceptive methods in the US, Nigeria, and South Africa, right? And very low uptake of those methods. We saw that 10% uptake. We saw a change, 3 to 5% change in unintended pregnancies in the US and South Africa that were modeled out. This was modeling, it wasn't actual interventions. And then in Nigeria, or in countries where you have lower contraceptive use, the estimated impact was a 38% increase in reduction rather in unintended pregnancies. So as we integrate these new methods into the method mix, we need to continue to do more research around it and make sure we understand both the cost effectiveness as well as the implementation programming elements, and try to market and let people know, hey, these things work and they're helpful, and people like them a lot. So hopefully they like them. And so the last thing I want to kind of get to in this space is go back to a policy document that was written by Tim Shan in the Global Action on Men's Health, right? So it's called Out of Focus, and we'll link to it in the notes afterward. And then they reviewed 37 global or regional policies, and in that space, they found that only 16% of them mention men at all, right? And these are sexual and reproductive health policies, and only 16% of them mention men at all. And most of the time when they're mentioned, they're as barriers to women's contraceptive uptake. Right. So this is a really important point. And I think my colleagues will articulate this better than me, is that, when you start to when you don't even include them in the policy, then where do they fit in? Right. So how we need to start thinking about this and rewriting these policies and imagining where we want men in this space and where men want to be in this space. Right. So not every guy's going to get a vasectomy, just like not every woman's going to use an IUD. Right. Not every guy's going to use one of these novel male contraceptive methods, just like every woman's not going to take the pill. So I think we need to really imagine this space differently and creatively, and find ways to, up our game for guys. I think guys are ready for this and they're waiting for us to do this. So those are my 3 points. I think those are, I think, important steps to take. Thanks.
I'm happy to also, provide some comments here. I mean, I think going back to the policy discussion, we need to be front and center in, outlining policy that is inclusive of engaging men in family planning and reproductive health. For the clinical preventive services for women that report out of the Institutes of Medicine at the time that helped to, incorporate all of those recommendations as part of the ACA mandate. They recommended to do a similar approach for men, but that's never been accomplished. We need to be at the table to ensure that those types of reviews and policies, are not only developed but also implemented. Going back to clinical care guidelines, it's only really been in the last 10 years that we've had domestically through the American Academy of Pediatrics guidelines to outline reproductive health and sexual health care for boys, male adolescents, for the first time out of Title X in 2014 guidance, to really outline the care package for men across the reproductive age spectrum. There, about just 2 years later, only the first time that International Planned Parenthood Federation put out a global package for men's sexual reproductive health. It's a nascent, field, but we really need to be out in front and center to promote what this looks like. Young men in the work that I do are really interested in this, not only from the research that I do, but clinically in the care that I provide. They want to be part of these conversations. They're interested in new contraceptive technologies, but they don't know what they don't know. And it's really behooves us in the medical fields and public health fields to take greater responsibility to include and educate men and families. I love the points that both Meg shared and Taveeshi shared. I mean, we need to start early during middle childhood, support parents to have these conversations, not only around sexual health, but across, health in general. Other work that I've shown, really a large part of declines in boys' use of just routine preventive services starts during middle childhood after their 5-year-old required immunizations that are mandated for schools. About 20% of male adolescents really are out, fall out of routine preventive care. And you can't blame the 5-year-old. It's the families that just don't understand the importance of keeping their children connected, and particularly their sons, because there are other, regular touch points that girls start to have as they transition into puberty and with menses and contraceptive care. And so how do we think about, engaging increasing male engagement, during adolescence? Could a sexual health visit that's annual be, really a way to think about this, not only, domestically, but globally? How to ensure that all the clinicians that are serving, populations across life's course have the training and the skills and confidence to deliver these services, that they do it for women, they can do it, for men as well. And really, think about other locations to engage men. We've been talking a lot about the clinical care space, but how to reach men through schools, through jobs, through employment. And Taveeshi's comment, I had the similar one about there is no paternity care touch point, right? So how do we engage men through maternity care, midwives, doulas, and starting early, during pregnancy is so critical to help the family, appropriately plan the timing and spacing of children. So there's so much work to be done, and it's an exciting time, to have this conversation.
Thank you. And we're getting a lot of interesting questions related to the points that our speakers have made. So we'll get to those in a moment. But I want to ask one final question. What do you see as opportunities in your work and in the culture for a more human-centered versus gendered approach to sexual and reproductive health and contraception? Meg, I wonder if you would like to share your thoughts first, and then we can open it up.
Thank you. I think one thing is it's in the caregiving space, there's a kind of an effort to stop talking about the burden of care and start talking more about the joy and the pleasure of being more engaged with children and being more engaged with people that one loves in the family. I'm thinking unpaid family care. And I think that there's like a reframing that needs to happen in reproductive health too. It's not just the job of fertility regulation, but the joy and pleasure of pleasure, of mutuality, of communication, et cetera. So like we have a branding problem, I think, in a way, and we also talk about this so much without talking about sexuality and about pleasure. So I think somehow bringing that in more in what we have to say is really important, and kind of making the case that boys and men are missing out on something really wonderful and powerful. And by the way, it has really serious consequences for girls and women too. But we tend to focus on the second thing without that positive framing of the first part. So I think, yeah, it's a how we frame and how we brand this work, I think is extremely important.
Thank you. Do others want to weigh in?
I love the idea of rebranding this. I think one of the real kind of human-centered things that need to happen is when the Malawi example, Banda Barejo, these are really intensive interventions, right? So they're intensive interventions where men have to participate for a significant period of time. In the context in which they're implemented, they they come back for repeated sessions, and that's a lot. What we don't know yet is how to brand this and market it in mass. And this is where human-centered design and understanding that you're going to have a number of, just like one of the links in there is the do's and don'ts, and it was mentioned earlier, not all men are the same. So what are the various messages that can be mass mediated or social mediated or community engagement ways that the NFL or the NBA or some of these big leagues that engage a lot of men can start taking on. We need to start putting some pressure on these organizations that engage men and around a lot of things, but not their health. They'll sell them a bunch of beers and potato chips, but they won't engage them for their health so they can keep watching their football games, right? So part of this is we need to keep these guys engaged around their health, and how do we brand to them, not just football fans, but also the video game players and the guys who are doing other things. How do we kind of engage them around sexual and reproductive health that is going to keep them part of this conversation and make them better partners? I mean, that's really, at the end of the day, make them a better partner for the people they love.
I just want to add, I mean, it sounds counterintuitive to say this, but I think we need to start thinking about technology and sort of the ways in which we actually utilize technology for all the kind of good connection. Our work in Colombia has shown that, when you have those intensive programs and you have sort of groups of fathers or, husbands or boys who are working multiple jobs, they don't have time to show up for these like in-person sessions, right? And so we did a human-centered design approach there and found out that actually WhatsApp and digital modalities were something that they preferred. And we've got some incredible connections, long-lasting groups that are sustained through technology. So while, of course, it has a lot of responsibility on practitioners to think about ways in which technology doesn't sort of cause more harm, at the same time, recognizing that actually it can create connection, relationships, ease of information delivery. There's tons of evidence out there around like chatbots being used by adolescents to get good, strong SRHR information that they wouldn't receive in any other way. So I think using that as a platform to leverage, but then doing enough research to say, how do we do it in a positive way is very, very important as well.
Yeah, I had a similar thought to Vichy, thinking about particularly boys and young men and their use of social media. Are there key influencers who can help reframe some of the attitudes around this? Arik, I see you came off mute.
Yeah,
Did you want to?
building off of Taveeshi's comments, it makes me think, I mean, there's a great resource called amaze.org. If for those who may not be familiar with it, it's an infographic series of short videos designed for 10 to 14-year-olds to learn about sexual reproductive health. It's translated in dozens of languages across the world. And really some of the design is for young, adolescents to watch these videos with their parents to help stimulate, conversation and discussion. We need, more approaches like that. With work that I've been doing to adapt a clinic-based app to use with young men before their clinic visits to learn about family planning and sexual health. And it's for adolescents through age 21. We have a design team of young men and who are older, on the older age of the teen years, who love these videos. They preferred them over some of the other maybe ones that had real people that we thought might be more applicable for older adolescents and young adults. But the using technology is so critical. I've got another project that is an intervention to start texting fathers-to-be during mid-pregnancy to really help be that paternity care touch point that doesn't exist, to help really translate a large body of literature that Taveeshi shared on the importance of engaging fathers early on the health of their partner, on the health of their baby at birth, and then keeping them involved as fathers. And it's been really received very well. We're still testing its feasibility and acceptability by both fathers and their partners. And we're really seeing great signals and change in self-efficacy and confidence around infant care behaviors, as well as their behaviors after the baby is born. We really need to think about, innovative technologies to help support this space.
Thanks, Ari. Well, thank you all for your thoughts on creating an evidence base for reframing family planning and contraception. It really is critical to consider both short-term realities and also plan strategically for the long term to ensure we can shift the landscape so that people of all genders are included in their own sexual and reproductive health. But now I want to move to questions from the audience. We've had several great questions that have come in. So let's go back to the current global political and funding environment. As we all know, this is a major barrier to shifting gender norms and achieving reproductive health for all. So a couple of questions have asked, what do you see as actions or messages that male reproductive health advocates should be emphasizing now so that progress can be made in the medium and long term? So from an advocacy standpoint, what are your thoughts on messaging right now, given the current environment?
I'll jump in. So I think there's a lot of things. I feel like I've been talking a lot. So the one of the things I think is elevating just our understanding as to the maturation process of men and boys, right? In elevating that for parents and teachers, and I think a lot of people like Gary Barker and Richard Reeves have gotten out there on the circuit and talk about some of these things and tangentially related aspects of this. I know Naomi Way's been on several different podcasts and things like this as well. She talks about it a little bit more focused manner. But I think just kind of elevating that our awareness of this process for men and boys, and how it kind of, we talk about also things like the loneliness epidemic in the United States and around the world. That's a product of that inability to be emotionally intimate. If we think about this, you don't have the ability to make relationships and maintain relationships as a young person. It impacts your health as a young person and your engagement with the health system. And then over time, you grow up and you get older and you get into these spaces and you still don't have those skills, or you don't develop those skills, you have a real challenge. And it can result in you getting older and finding yourself with a wife and a family, which is great, but maybe you don't have the outlets and the networks and the men in your life that you can turn to for assistance. And this is why, we talked about the life course, model previously. All of this is related, and these touch points are so intimately kind of close by one another. I think it's so important to kind of reflect on how this one is related to the other in terms of men's overall health. I think this is really kind of the key thing, is if we talk about men's health and holistically, it starts from this intimacy and being able to maintain good relations. People get afraid of the word intimacy, but like, maintain those relationships and be a good friend and be there for the person and ask the right questions and share of yourself as you can. I mean, that's really critical. And many of these speakers don't talk about that. Many of the men who are on the circuit and the people who are in the forefront, they're not talking about that. They're talking about other things, which is important as well. But we got to elevate this element of the conversation as part of this.
Go ahead, Margaret.
Just building on what Dominic just said, in the Getting to Equal report, that the link for which was shared, we tried to, it's very typical for to look at the long-term impacts of being able to use contraception and plan childbearing for women, and the impacts on their work, their relationships and so on. So we tried to look at the very limited data that's available on men in this respect, and in addition to seeing impacts on, loneliness, relationships, longer term health, and so on, the management of childbearing has really important implications for living arrangements, potentially for work, et cetera. And I think that making that case, that it's not just like it's this little health issue, it has ripple effects. How you manage your sexual and reproductive life potentially has ripple effects throughout your life. And I think making that case more powerfully is another thing that we could, another strategy that we could mobilize at this time.
And for those of you who've worked in low and middle income countries, there was a question about one of the current challenges being continuity of family planning programs, right? Can any of you make recommendations for advocacy in countries where, we've seen a decline in fertility, but the current challenges around particularly US policy and funding for these programs is going to impact other countries?
I mean, I can talk a little bit, but I don't work directly with providers, but I would love to sort of have my other panelists step in there. But the reality is every time you do a program, right, you sort of walk in knowing that governments can change and buy-ins can change at both national, subnational, district level. And so I think, one of the ways in which you have to try to kind of develop and build your program from the get-go is building those sustainability measures. And I can speak a little bit about, I mean, lessons learned, right? I mentioned that Bande Barejo is in its 10th year. I can promise you we did not begin like that either. And, it's not just sort of about having sort of government buy-in, but funding challenges around. We didn't have one person sort of step in and say, we're going to give you a decade worth of funding. Funding often kind of goes in 2-year cycles, and they expect outcomes in 2-year cycles, right? And that's not realistic when you're talking about things like norms changing, etc. So I think, first off, sort of recognizing how much you can actually achieve in those constraints around funder needs and government changes, and then kind of trying to build that into your monitoring evaluation, your indicator, right? All that kind of becomes, that should be the first step, right? As opposed to sort of thinking about that post hoc. We're very lucky that we were able to kind of have that. Both the Rwanda is a very unique context in its own, as well. But I will say that I think, recognizing that those shifts are going to happen, whether or not the US is in its own unique political moment, I think becomes a part of how we should begin all our work in programmatic elements. But I would look to my panelists to talk a little bit about if they're seeing any impacts right now because of the abrupt stop in all these funding that it's happening all over the world.
And I will add to that, I know that some funders are more open to this than others, but the incorporation of civil society organizations, community leaders from the beginning as part of that sustainability piece and advocacy. Did anyone else want to jump in on that one? All right, well, let me move to another question. And this one might seem a little provocative, but I think it's a great one. And it's the question about men's reproductive rights. So pregnant females can choose abortion or, contraceptive methods, even when the biological father wants the child in many places, right? So there are many places where family laws do not sufficiently take men into account. And so this sort of perpetuates this idea that men are sperm donors, so to speak, and that the responsibility of the care of a child, it falls solely on the woman. So we talked a bit about change in contraceptive policies. What about family law policies? Any thoughts on what could be done there to further incorporate men as caregivers and in family planning?
I can
I
speak
think,
at it a little bit from the ethics perspective, maybe not as much law, but I
Yeah.
think this is exactly right, is that men's reproductive autonomy is diminished because of the dearth of male contraceptives, and that it's unfair to hold people responsible for unintended pregnancies when we don't equip them with the tools to prevent them. So if the best option for someone who's 25 is condoms because they're not yet ready for a vasectomy, that has about a 16% failure rate. That's really high compared to the methods that we have for cisgender women. And so I think we need to recognize this. Does that mean then that men should make decisions about women's bodies? No. But there have been some provocative bioethics commentaries talking about, is it fair to hold men responsible legally, financially, for something like this, if they took every precaution that they could, or if we don't equip them with those tools. The other point I just want to make is there is this idea that pregnancy has more consequences for women. And yes, that's true if we're talking about the experience of pregnancy for 9 months. However, I think what we neglect to talk about is that there's this assumption that women are going to be the primary caregiver from 0 to 18. And so if we had a different culture in which it was assumed that men would be the primary caregiver, I think we would understand the consequences of pregnancy very differently.
I just
Great
want
point.
So, yeah, and I just want to add, I was in a room recently, and this sort of shifts it from like SRHR, but it goes back to Dominic's point that actually how much of this is sitting within an ecosystem, right? We can't talk about sexual reproductive health and family planning without talking about families and wellness and all those things as a unit. So I just dropped a link for this New York City DYCD, and the New York City Child's Cabinet did an event just a couple of months ago around the Fatherhood Initiative. And in that, they had brought up this issue. And I don't think it's actually that provocative, but they brought up this issue that there are fathers who by default don't get custody and are only sort of relegated to providing child support, because that's the assumption of the legal system, the judges who are making sort of, the judgments on the child custody cases, etc. And I think it goes back to also Margaret's point, how we need to reframe this, right? Men, if we start seeing many fathers as wanting to be fathers, as wanting to be involved, essentially, right? I think that's where we need to sort of start shifting that narrative and thinking about policy change, better training, whether it's at legal system. There's a whole slew of like work that's happening. And again, it was brought up a couple of months ago with fathers who are incarcerated. And so, right, and the ways in which the criminal justice system in the US automatically assumes that we should be able to sort of separate that father from their family, da, 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 da. So it was just I found it very, very fascinating. And I actually think it's a really, really good point, and how much the laws need to start from, again, the premise that perhaps fathers do want to be involved. They want to have that relationship with their child. And we know those positive ripple effects of fathers being involved, right? For mothers, for the children, and then for fathers themselves. So I think, yeah, I just wanted to sort of flag that as an initiative that's taking place in New York City as well, tackling exactly the same issues.
Right. And even kind of getting it back to the going back to the emotional intimacy part of this is like, do guys really talk about their parenting? I mean, how do we normalize the expectation that you're gonna be a parent, and if you're gonna be an active parent, you're gonna be participating in your kids' lives, you're gonna make lunch, you're gonna pick kids up after school, you're gonna change diapers, you're gonna do all these other things, right? So, the reproductive burden, kind of recently was a paper that came out around what was it, Men's Keeping from Stanford, came out about maybe 4 or 5 months ago around men's keeping, and the not just the reproductive health burden, but the other burden of both taking care of children and taking care of the home, and also taking care of this guy's emotional and his needs, right? So like, how does he show up as an equal partner? And so I think this is really kind of getting at the bigger picture in terms of, yeah, they need the rights. They need to be have the right to be the parent, but they also need to be the parent, and they need to be part of that relationship in a holistic way and be present. Because a lot of times they're not. Uh, I would never assume I fulfill 50% of the role in parenting in my house. I would like that I have these great moments, but I know I'm not 50%, and I'm on the upside of this whole thing. So I really, I respect that this is not an equal burden, and sometimes that's okay. Maybe there's other things that he can take on in that context that kind of levels it out. But that needs to be an open conversation, and that's not an easy conversation.
Yeah, and I know there's a lot of discussion around the mental load and the socialization process that starts very early in regards to gender around mental loads and caring for children and households. So I want to touch on this idea of comprehensive sex education. And there was a question that talked about bringing lessons on gender norms, and how we can expand into social media around this. Of course, there are lots of news articles and blogs and whatnot about the quote unquote manosphere and influencers such as Andrew Tate, who are pushing harmful masculinity views and enforcing traditional gender norms. Um, and so the question is, does this reinforce views that sexual and reproductive health is a women's issue? And how can we combat this or work this into policy? Because it seems that so much of that, the social media content is interconnected with the lack of comprehensive sex education in schools.
In the US context, the Futures of Sex Education for decades has been promoting comprehensive sex education from kindergarten through 12th grade that integrates age-appropriate, developmentally appropriate content, including, the kind of content that you're talking about. Other countries are models in doing this as well. The Netherlands, for example. I really, I think trying to think about how I'm not familiar with any specific work that's taking that to social media platforms, but those might be opportunities, to consider how do we translate that type of curriculum, to other platforms, and really, the need, for standards that are at a national level, not just in this country. It's determined state by state, sometimes jurisdiction by jurisdiction, and sometimes at the principal level because of the power of the PTA, right? So how do we turn that over and really ensure that, just like standards of math and other curriculum standards of health education are being taught to all of our children, not only around sexual health.
Any other thoughts on that? Well, let me spend the last few minutes asking you a couple of questions that'll lead us to a more positive note. We've talked about a lot of the challenges, so let's talk about some of the successes. So one question came in that asked about communication across some of these fields. So we've talked about policy, clinical settings, changing social norms. And so outside of this group of impressive individuals, do you see communication happening across sectors in regards to men's role in contraceptive and reproductive health?
You asked for positive. I'm
Yeah, I was hoping this one would get us there.
I think I'll speak a little bit like a 20,000 foot view on this. I think 20 years ago, in male engagement or boys and men was such a kind of peripheral topic, right? In a word. And I remember 20 years ago, there was a need to make a case for why boys and men. Why do we even need to engage them? And now, 2 decades later, I think we have at least sort of overcome that hurdle. And so every sector, space, thematic area that we at Equimundo sort of end up being in, we no longer have to make a case for why boys and men. We need to talk a little bit about how and what are the drivers and all those kind of more important questions. So I do think that we have, as a larger field, right, in the international development space, moved beyond that. That being said, I think sometimes, and I say this with all positivity, that I think, the evidence base is still being built. And so this idea of engaging boys and men seems to end up becoming like a buzzword, and sort of just throwing it in there into whatever strategy and plan and policy and, sort of kinds of gets in there, that without actually having a really thoughtful understanding of what needs to happen to make those intersectoral linkages effective, right? And I think that, again, I look to my colleagues to talk more about sort of this sexual reproductive health space, but I think it sort of is still in this world on the periphery of like things like consent and things like, it's still sort of touching just on the safe spaces perhaps, and not really asking those very challenging questions of like drivers. What do we need to change, right? What are some of the protective factors? And I think those are the conversations that we need to get to, again, across sectors to make that happen. But this is just my kind of larger field analysis, and yeah, would love to hear from others.
We've seen changes. I mean, if we look at bad American movies, in the 80s, we had Mr. Mom, who couldn't change a diaper and didn't know what to make for dinner. And then we had, 10 years ago, What to Expect When You're Expecting. And it's the bros group of all dads out there with their pacifiers and their bottles. And so, I mean, we've seen these changes. There's terminology out there now, like stay-at-home dad, which was not something you could put on the consensus, on the census, 30 years ago. So I think language is evolving, and we see that younger, progressive men are more interested in being involved in reproductive care, and that extends also to child rearing. But we also know this is a problem. I mean, Saturday Night Live recently had a skit on Man Park, where so look it up. It's basically this idea that men have no one else to go to, no emotional outlet besides their female partner in their life. So instead of dog parks, you can take them to a man park where they can talk to other men and play and whatnot. But we recognize this as a society. So using those sorts of outlets and using humor sometimes can help us move past the awkwardness and some of those difficult conversations. So if we can get media to keep doing those sorts of things, maybe that can help us continue to be positive.
Yeah, I do. I get really excited about some of the Saturday Night Live skits. There's several of them. There's like the single straight male friend or something like that one that's really good. But the humor definitely plays in. And I just put a link in for these kids out of Colby College who started a TikTok feed that's kind of it's talking about reproductive health, but it's also talking about consent. They're talking about, kind of being a better partner and things like this. And it's happening. And I think we need to kind of pay attention to what Gen Z is doing at this moment in time and start to really help ourselves understand what they're doing and the context of it. And then help them to elevate their own messages. And we talk about human-centered design, and we talk about this human-centered activities we want to be implementing, and we really need to engage these kids, these younger people. I guess they're not just all kids, in the work that they're doing, and then the ideas they have about sex, and because it's changing, it's different. It's similar in many ways. There are a lot of young people who are having sex at this moment in time, and ways that they were doing it similarly 30, 40 years ago, 20 years ago, but it's also changing. For many of them, on average, they're having sex later. They're engaging with the health sector in different ways. They are they have much more access to information than we ever had 20 years ago, 30 years ago, or however many years ago. So their context is different, and we need to understand what does sexual and reproductive health mean to them, as Taveeshi mentioned earlier around technology, and Arik mentioned earlier around the technology that he's implementing. And like, but I do feel like there's, as much as we can create interventions, we need to also be learning from these young people as well, because the delays are across their life, right? They're not just having sex later on average. They're in the US, I'm focusing on the US. They're also drinking alcohol later or less frequently. Maybe they're using marijuana more frequently because of the access and exposure, but I'm not sure of that. I think it's actually happening later for them as well. But there are different things that they're doing that are happening later in life, and part of that's due to parenting. Jean Twenge book called Generations that I refer to. It's always a reference book for me when I start to look at differentiation between generations and sexual and reproductive health, but other things as well. But it's a great resource to kind of check out. But she kind of leans heavily on the way in which we've parented as Generation X, and the relationship that we have with our kids, and the helicopter parenting is in many contexts, and not every context, but in many contexts. So I think finding ways to we're talking about cross-sector communication. We've got to figure out how, for young people, what does that cross-sector communication mean? Well, how do they view their health? We also know that this generation is very diagnosed in terms of their mental health. And so how does that impact their prospective, kind of like the way in which they view their future, and the way in which they view parenting? We're seeing a lot of interesting trends that need to be researched and understood around permanent contraceptive use, particularly post Dobbs, but it was kind of happening before Dobbs as well. So we need to really figure out more about what is happening in our space in the US, and globally as well, but kind of learning from the younger generations as we start to develop interventions and programs for them.
Thank you. Well, I appreciate you all helping to end this on a positive and hopeful note. I think in times like these, where there are big challenges, we need to focus on the successes that we've been having, and highlight those, and lean into those, do more of that. So thank you. Thank you again to everyone for attending today's listening session. We will be sending out the links to the recording in the next few days. Please do join us for our next session on men and contraception, which will be held on May 14th at 9 a.m. Eastern Time, 2 p.m. Greenwich Mean Time, where we'll dive more deeply into men and novel male contraceptive methods. Please keep your eye on the Male Contraceptive Initiative website and social channels. Thank you to all of our panelists. Really appreciate your time today. Thanks for a great discussion. Take care, everyone.
Thank you.